What you do tonight in the final hour before you go to sleep may quietly decide how your heart performs in the most dangerous part of the next day. This is something most people never think about because sleep feels safe. It feels like a time when the body finally rests. But for your heart, the story is very different. And for many older adults, it is one of the most vulnerable windows of the entire day. Before we go further, I want you to pause for a moment and do something simple. Put your hand on your chest. Feel that heartbeat. That muscle has been working every second of your life without a break. It does not stop. It does not slow down enough to rest the way your mind does. And tonight, while you are asleep, it will go through cycles of stress, pressure, and recovery that most people never learn about. The problem is not only what happens during sleep. The real problem is what you bring into sleep with you. The last hour before bed sets the stage. It decides whether your heart enters the night prepared and protected or already under pressure before the real stress even begins. Your heart is not stable during sleep. It does not stay calm in one steady rhythm. Instead, it moves through repeated cycles that change how your body behaves. In the early phase of sleep, your blood pressure drops and your heart rate slows. This is the recovery phase, and it is important. But it does not last long enough to protect you if the rest of the night is working against you. Every 90 minutes, your body shifts into a different phase where heart rate becomes less stable, breathing patterns change, and blood pressure can rise again. These cycles continue throughout the night, repeating again and again. Then comes the most critical period, the early morning window. Between 4 and 6 in the morning, your body prepares to wake up. It releases cortisol, a hormone that increases alertness. But cortisol also raises blood pressure, increases heart rate, and makes your blood more likely to clot. This combination creates a perfect storm for the heart. This is why heart attacks and strokes happen more often during early morning hours than at any other time of day. If your heart enters this window already stressed, already under pressure, already struggling to recover from poor habits before sleep, the risk increases even more. This is why what you do before bed matters far more than most people realize. One of the most common habits that quietly damages this process is using your phone before sleep. Many people see this as harmless. They scroll, watch videos, read messages, and think of it as a way to relax. But the effect on the body is not relaxation. It is stimulation. Your body produces a hormone called melatonin at night. This hormone does much more than help you fall asleep. It plays a protective role for your heart. It lowers blood pressure, reduces stress signals, and helps your blood vessels relax. It creates a calm internal environment where the heart can recover. The light from your phone interferes with this process. Even if you feel sleepy, even if your eyes begin to close, the internal system that protects your heart may not be working properly. The result is subtle but important. Your body enters sleep without the full protection it needs. On top of this, the phone introduces small interruptions. These may be so brief that you do not remember them. A notification, a light change, a shift in attention. But your nervous system reacts to each one. These small stress signals keep your body slightly alert instead of fully relaxed. Over time, this creates a pattern where your sleep looks normal from the outside, but your heart never fully enters recovery. Another habit that seems harmless is sleeping in a room that is too warm. Many people prefer warmth because it feels comfortable, but your body needs a drop in temperature to enter deep sleep. This cooling is part of the natural signal that tells your body to rest. When the room is too warm, your body struggles to release heat. Your heart continues working harder than it should. Your blood pressure does not drop properly. Your sleep becomes lighter and your body moves in and out of deeper sleep instead of staying there long enough to recover. Even a small difference in temperature can change this. A slightly cooler environment allows your body to relax more deeply. Over time, this can improve sleep quality, reduce stress on the heart, and support more stable blood pressure through the night. Now consider something that many older adults do not even notice. Going to bed slightly dehydrated. After the age of 50, the body's thirst signals become less reliable. You may not feel thirsty even when your body needs water. This means many people reach the evening already underhydrated without realizing it. When you sleep in this state, your blood becomes more concentrated. Your heart has to push harder to move it. At the same time, your body may increase blood pressure to maintain circulation. This combination puts extra strain on your cardiovascular system during a time when it should be recovering. Dehydration also affects how your blood behaves. It becomes more prone to clotting, especially during the early morning window when clotting risk is already higher. This is not something you feel immediately, but it creates a condition where your heart has to work against a more difficult environment. The key is not drinking a large amount right before bed. That can disrupt sleep. The key is maintaining steady hydration throughout the day so your body enters the night balanced and prepared. Eating late at night is another habit that adds pressure to this system. The body processes food differently in the evening. Digestion slows down, blood sugar responses become stronger, and the body must work harder to manage nutrients. When you lie down soon after eating, the digestive system continues working while the rest of the body is trying to enter sleep. This creates internal stress. It can also lead to acid reflux, which affects a nerve connected to your heart. This connection is often overlooked, but it can trigger sensations like irregular heartbeat or chest discomfort. Late meals also increase inflammation within the body. Over time, this contributes to the overall stress on your arteries and cardiovascular system. Finishing meals earlier in the evening gives your body time to process food before sleep begins, allowing your heart to enter the night with less pressure. There is also a condition that many people do not realize they have: sleep apnea. This occurs when breathing stops repeatedly during sleep. Each pause may last only a few seconds, but the effect is significant. When oxygen levels drop, your body reacts immediately. Stress signals are released, your heart rate increases. Your blood pressure spikes. This can happen many times each hour, creating repeated stress cycles throughout the night. The danger is that many people are unaware of it. They may snore loudly, wake feeling tired, or feel exhausted during the day, but never connect these symptoms to a deeper issue. Over time, untreated sleep apnea places continuous strain on the heart and significantly increases the risk of serious cardiovascular events. Finally, there is something that most people never measure: blood pressure at night. Many people check their blood pressure during the day and assume that is enough. But the night tells a different story. In a healthy system, blood pressure drops during sleep. This is part of recovery. But in many older adults, this drop does not happen. In some cases, blood pressure remains high or even increases. This pattern is often hidden. Daytime readings may look normal, while nighttime levels quietly place stress on the arteries. Over time, this contributes to damage that is not immediately visible, but becomes serious later. Checking your blood pressure at different times can help reveal patterns that a single reading cannot show. What makes all of this more serious is that these habits rarely happen alone. A person may use their phone before bed, eat late, sleep in a warm room, drink too little water, and experience poor sleep quality at the same time. Each factor adds a small amount of stress. Together, they create a much larger effect. When your body enters the early morning phase, it is already dealing with multiple pressures. This is how risk builds quietly over time. Not from one major event, but from repeated small habits that work against the body night after night. The important part is that this pattern can be changed. The body responds quickly to improvement. Better sleep environment, earlier meals, reduced phone use, and steady hydration can begin to shift the system back toward balance. You do not need to change everything at once. Even one improvement can begin to reduce pressure on your heart. With consistency, these small changes can create meaningful differences in how your body handles the night. Thank you so much for watching Senior Health with Dr. Sarah Mitchell. If this video helped you understand your health more clearly, please like, subscribe, and turn on the bell so you do not miss our next videos. This content is for educational purposes only and does not replace medical advice. Please speak with your doctor before making any changes. Take care, stay safe, and may you have better health and peace in the days ahead.